Hello, welcome back. In this short video, we're going to be looking at the different experiments that you're going to be getting involved in, all centered around respiratory pharmaceutics. And this set of experiments will help you untangle how all of the different variety of respiratory formulations work, how they manage to deliver drugs into the deep lung, and also try to get some sense or to get some conceptual understanding of the challenges that trying to deliver such small particles into the deep lung create for formulators. In the first practical, we're going to be looking at a nebulizer. Here we have a conventional nebulizer, which there's instructions here in terms of its operation, but it's pretty simple. You put the fluid into this cup, close the lid, and the patient can breathe through this nozzle. Alternatively, we can fit it with a face mask, and you can operate that too if you like, and see how that produces those small particles that I mentioned, which are delivered then into the patient's lung. In the lab handbook, I mentioned that this is a really versatile way to deliver drugs to the lung, and the drug that you're going to be, extemporaneously preparing and delivering to our theoretical patient is colamycin. And we need to be careful when we're formulating colamycin that although we want to mix the formulation, if we shake it too vigorously, hopefully you can see in the camera there that it creates a lot of bubbles. It creates a lot of bubbles. And those bubbles obviously are going to affect the way, the ease, if you like, of delivering the appropriate dose of this medicine. So we want to take that into consideration, and we're going to look through the patient information leaflet to accurately prepare this dose of colamycin. I've also have some Ventolin here too, and some saline stereonebules, which will help you, create your colamycin solution and formulate the nebulized solution for delivery for salbutamol if you wish. Okay, and of course, as always, there's some reflection points in the lab manual that I want you to think about with respect to the efficacy, right, of how efficient this delivery system can deliver drugs to the site of action in the lung. In this station, you've also been provided with a more modern nebulizer, if you like, in the Respimat formulation, which we can see here. And on the day, I would like you to open this up and operate it and compare and contrast the similarities and the ways in which these two formulations deliver drugs to the lung. And in the notes, you'll see that the Respimat can deliver drugs much more efficiently than the nebulizer. And I would like you to maybe postulate why. And that certainly will become clear in a visual way when you operate both of these formulations. In the next experiment, you'll be looking at how the shape and the size of the particles, and we've got sugar here, just as an example, how they can be modified to try to enhance or improve the effectiveness of delivery to the lung. We'll see how reducing particle size is going to slow down, if you like, the rate of movement of a particle through the air when pulled through by gravity. And we're going to think about how that correlates back to the behavior of drug deposition from our dry powdered inhalers and also our more conventional metered dosage inhalers as well. Okay, so really in this next experiment 2, we're thinking about the shape and the size of particles. We're going to be looking at the behavior on a macroscopic scale here with our torch, which allows us to see really fine particles. And we're going to be sprinkling our solid onto this glass, watch glass here, watching the rate at which the particles move through the air, milling them down, seeing then again how that rate changes as you decrease the particle size. And then looking, we'll have prepared a couple of microscope slides for you of different drug particles that have been taken from different inhaler products, and they'll be sat out here for you. And again, looking at those particles under the microscope, having a look and having a sense of, that was the end target of a large, formulation and development program for these various inhaled products. And you can see then what the optimum is. And we're going to reflect then back onto the way in which we can formulate new medicines in the dry part inhaler format or in the metered dosage inhaler. Okay, so again, this station is about thinking about how the particles and their size and shape can affect that delivery to the deep lung, right? Which is again commonly our goal for inhaled formulations. Okay, so in this next experiment, experiment 3, we're then going to be thinking about how the MDI, in particular the immediate dosage inhaler, which produces that high velocity of solid, right, or that powder or atomization through the inhaler, that high velocity going into the back of the throat, how that can create charge, and maybe how that charge can affect the efficiency again of delivery from our various inhaled products. Okay, so what you'll be doing in this is first thinking about static charging in a conventional way, in a way that maybe you've seen before, and that's where we're going to blow up a balloon, and we hopefully will have a volunteer in the room that might allow you to rub the balloon on their hair and create a static charge again. And we're thinking about how there's energy that's put into the balloon, if you like, into the rubber of the balloon, that's going to create a static charge. And then we're going to be thinking about the material. Not all pharmaceutical products or powders will create a static charge when energy is applied. And so the way which we're going to investigate this or explore this is going to apply energy using a ball mill, okay? And this is a chamber of a ball mill here. We'll have the full apparatus on the day, but effectively we have a little enclosed space which has a steel ball, and you're going to put in a small amount of powder, maybe just about 100 milligrams or so, into this chamber, screw it together, and you're going to place it into the ball mill. And one of our technical colleagues or myself will be there on the day to help you set up that ball mill to get everything right. I've just got one powder sample here, but we're going to be trying 2 products, okay, 2 pharmaceutical powders, and we're going to be milling them both just to demonstrate that, again, yes, energy is required, right, and that energy can come from the metered dosage inhaler, right, that high force and velocity from the spray, but also the material is also important. Like the rubber, like the balloon, it can become statically charged, but some pharmaceutical powders can and can't. And of course, we're going to be thinking about that in the context of the spacer, okay, the spacer device, and I will have an example of the metered dosage inhaler too to help you, again, conceptualize the triborough electrification concept. And we're going to be thinking then again about what ways in which we can try to reduce that static buildup in spacer devices, which can dramatically reduce the efficacy of the spacer in terms of inhaled drug delivery. And we'll have a small solution of surfactant here, which you're going to use to clean or try to clean one of these spacer devices. And again, in the lab notebook, there's some reflection points to help you there. And in particular, look at the story from Benjamin Franklin about how surfactants or surface active materials can create a very thin layer over the surface of different things. And the example in Benjamin Franklin is the sea, right? That's one phase, if you like, at which the surfactant forms a monolayer on that surface of the sea or of water. And in this case, we're hoping that our surfactant will create a thin monolayer, or a thin layer, if you like, on the surface of the plastic of this inhaler, and that's going to stop that charge buildup for a short time, okay, to again enable that or maximize drug delivery to the lung. In your final practical in the respiratory lab, you're going to be trying to bring all the concepts that we've looked at together, okay? In that, we want to generate an atomized or a slow moving vaporized phase, if you like, and maybe we saw that with the nebulizer in the modern Respimat formulation. We don't want that rate of that production of that vaporized phase to be too quick, right? Because we're going to possibly generate static charge. And we also want really small particles as well, right? To enable that movement of that drug into the deep lung to maximize delivery to that site of action. And we're going to be looking at a modern drug delivery system in that context in the e-cigarette, okay, or the vape, all right? What we've got here is what's known as a Copley impactor. And a Copley impactor is, in this case, horizontal, but traditionally, the Copley impactor, the USP impactor, is vertical, okay? And what we've got, and you'll see this on the day, is a series of stages, okay? So I'll hopefully bring this up. So what you'll see here is different sieve or mesh sizes, okay? Different sieves or mesh sizes. And your drug is going to be moving from the what's known as the USP throat, okay? So it mimics our throat. You apply the dose into the mouthpiece, and if you imagine like an MDI inhaler, a lot of that's going to hit the back wall of the throat, but in the vape, we might not see that behavior. It'll travel down the esophagus, the bronchial, the initial bronchial tree, okay, or bronchial tract, and into the Copley impactor, okay. And once in there, it will move through these sieves and become trapped within the sieve at various points, okay? And that the various points at which the material becomes trapped within the sieves relates to its particle size. And this is a really important or key tool that's used in the pharmaceutical industry to characterize the various different formulations that we use to deliver drugs to the lung, okay? And this machine effectively creates negative pressure, right? It's a vacuum, if you like, and all it does is it pulls air through the mouthpiece, right through the system, okay? Again, mimicking the lung. And you can set this to, withdraw air in a pressure similar to how a COPD patient might be able to withdraw air, right, in maybe a low pressure way, but then you might also be able to set it in a way in which someone with a healthy lung capacity can also breathe, okay? And you can also do more complicated things like tidal volumes, etc., and have a sinusoidal rate, if you like, of exhaling and inhaling with this kit, which is really nice. But in our experiment, we're going to be looking at how vapes deliver drugs into the deep lung and trying to see that come together for us. Okay, so that's us. Thank you again, and I hope you enjoy the lab.